There is a big headline this week every woman needs to be aware of. New advice from a major group of experts could impact when women in their 40s begin breast cancer screenings. The U.S. Preventative Services Task Force now recommends that women at an average risk for breast cancer wait until 50 to begin screenings. Once they turn 50, the group says they should have a mammogram every other year. The recommendations go on to say that after age 74, screening really isn't necessary. Now, these new guidelines allow patients more freedom of choice. They soften the rules for women in their 40s and require them to have a conversation with their doctor if they want to begin screenings before age 50. But these new guidelines also muddy the waters since they don't line up with mammogram recommendations from other groups. So joining us right now, she's the one that's going to iron it all out for you. Dr. Dawn Leonard, she's the medical director of the great Samuelson Breast Cancer Center at Northwest Hospital. Let's start. You're a proponent of women in their 40s going for the first time, right?
Absolutely.
All right.
Absolutely.
Positives and negatives about this.
The positives of starting screenings at age 40, at a younger age, to establish a baseline is that it's easier to establish change over time. Additionally, in our community, specifically in Baltimore, we actually have a higher number of women being diagnosed under the age of 50. So if we don't screen them between 40 and 50, we run the risk of them being diagnosed at later stages, and that worsens their prognosis and survival. So that's one of the benefits.
You ever hear of this group before, the U.S. Preventative Services Task Force?
Yes, we've been hearing about that.
You ever pay attention to them?
It's not my favorite set of guidelines.
I could tell.
I follow the American Cancer Society and the National Comprehensive Cancer Network guidelines.
Doctor, women are lucky that they can come to you because they are so confused. I'm a man, but women they tell me all the time, I'm so confused. One day you're reporting, we got to get it, 50, next day it's 40. Yeah. It's so much.
Yes,
so
it is.
Your advice is 40 every year.
Yes, my advice to my patients as a breast surgeon is start at age 40 and screen every year. The only good thing, really, about the new guidelines is that they recognize that a discussion should be held between a woman and her provider about what is right for them, an assessment of their risk, an assessment of their family history, and an assessment of their concerns about their screenings to make a decision together.
Now, in December, Congress passes a bill requiring private insurers to pay for mammograms for women 40 and over. And since the new set of guidelines says it starts at 50, how could that complicate things?
Insurance. Well, if insurance providers decide that they're going to flout our national law, well, then some women may not be able to afford screenings if their insurers don't pay, and that could increase the risk of being diagnosed with cancers at later stages.
And men also get breast cancer. What would be your advice? What age?
Well, men don't need annual screenings, but males should understand their family history, and they should understand if they're a person that's at increased risk of a genetic mutation, because if they are, then they need the same screening and surveillance that a woman would need. Very good.
Well, thank you for calming us down. I think you just evened out the waters.
I
Thank
hope
you, doctor.
so.
Thank
You're
you
welcome.
very much.
You're very